It's tooth truth time. I thought I could wait until next week, but I'm really impatient and my mind is like a beehive of ideas. So I was really looking forward to recording today's video about x-rays. The three most common x-rays you will encounter at a dental office are bitewing x-rays, which are taken yearly, and they're just 4 images of your teeth. Generally it's the crowns. You don't see the roots of your teeth or your front teeth, and these are used to diagnose cavities. You also have your full mouth series of x-rays, which is 18 individual films, generally taken every 3 to 5 years, depending on what your insurance covers. They're also used to diagnose cavities, but because we see more of your mouth, we can see things like infections, cysts, or other things that shouldn't be in your mouth. And then you also have your panoramic x-ray, which we use to refer you to an oral surgeon for wisdom teeth, your orthodontist for braces, or if we're treatment planning a denture, also for a lot of severe gaggers. Most dentists at this point have implemented digital radiography, which not only is saving processing time, but also it produces a much clearer image with a higher resolution. But I don't want all that radiation. Well, funny you should mention. Digital radiography also uses a lot less radiation, 70 to 90% depending on who is doing the study, but that also cuts down on exposure time. Wow! So I also have a handy chart if you're still not convinced, and I will include the link in the description, but it gives you, kind of quantifies just how much x-rays, how much radiation exposure everyone receives depending on what they're exposed to. So this big old square is maximum yearly dose permitted for US radiation workers. So if you take all the blue squares here and add them all up, this equals to 3 of those little green squares. And just this little square is dental x-ray. So don't be afraid. It's really good to diagnose things that even if they're not bothering you, we can see the beginning of a cavity starting. I know the x-ray sensors are a little uncomfortable to bite down, but I can assure you it's just a piece of plastic. I know people say it's sharp and it feels like they're cutting their gums, but when you put on the sheath, safety first, it creates these little corners right at the tip. And a lot of times this is what kind of digs in people's gums. I promise you, you're not getting sliced, you're not getting stabbed, you just have very tender tissue under your tongue. So come to your dentist, get those x-rays taken to make sure you don't have any cavities or anything worse, God forbid. But yeah, if you have any questions, enter below. If you like my video, please subscribe and hit like, and I look forward to more.